If I have a patient that has SIBO, here are some things, some tips that will make me think that maybe Lyme is a piece and an underlying cause of the SIBO. So there's three categories. There's a lack of risk factors, there's findings, and I'll show you the next slide for a second, and there's history. So lack of risk factors for SIBO, if the person reports no history of food poisoning or GI flu prior to the onset of SIBO symptoms, that makes me wonder. They have also no anatomic abnormality. For example, diverticulosis of the small intestine can lead to SIBO. There's no anatomic abnormality identified. That's a lack of a risk factor. No prior abdominal surgery, another big risk factor for SIBO. They have none of these three things. I'm wondering what could have caused their SIBO. Okay, possibly Lyme. In workup, the findings that also make me think about Lyme in SIBO are the patient has very elevated hydrogen and or methane gases. What I mean by very elevated is, like if I'm seeing hydrogen greater than 100 and methane greater than 70, somewhere on the test, then I'm thinking, you know, the hydrogen greater than 100, of course, is in the first 120 minutes. I'm thinking, is Lyme a part of this? I'm also, you know, I'm going to be doing further workup and looking for other symptoms that might point to Lyme, but it just gives me a little bit of a clue. Intractable or recurrent SIBO. I see this all the time. Patients that come to me, they've been worked up for SIBO, they've been positive, they've been treated for SIBO with very, very good protocols. It either never resolved or it went away and it just came right back despite the prokinetic therapy. I'm thinking, what is disrupting that MMC or in the vagal tone of the GI tract, and it may be Lyme. SIBO with negative vinculin antibodies. So the IBS Detect test, that's a test to Quest Diagnostics, a blood test. And a lot of people that have SIBO from food poisonings will have positive vinculin antibodies. You have elevated methane gases and you have negative vinculin antibodies. To me, that's another clue, possibly Lyme.